Well, welcome everybody back again to another episode of the Health Made Simple show. I'm here with the host, Dr. Bart Precourt, who has been a healthcare provider for over 20 years, practicing a range of modalities, including chiropractic, kinesiology, functional nutrition and supplementation, and lab testing, all out of his clinic, Balance Health Studio in Seagrove Beach, Florida, as well as virtually all around the world. He's also the founder of the Health Edge program, which is a cutting-edge health program for entrepreneurs and executives wanting to take their health to the next level. He works with celebrities and athletes all around the world, and tonight is available to answer your questions. So we already have some really interesting questions to dive into tonight. If you guys have more, though, please keep putting them in the chat, put them in Facebook, and we're going to send them over to you, Dr. Bart, and see how you go.
Yeah, I'm feeling sharp. So, Tuesdays are an interesting day for me. So I start early this morning. I know this is morning for you, but this is becoming like nighttime for us. So, this is a day that I have to increase my capacity, my brain. And it's kind of interesting. So I have like almost 2 days built into one. So I have these like little strategies when I get home from my first, I'll finish up with clinic. It'll be like, I'm gonna say just before 8 o'clock, I get started. By the time I get home, sometimes it's not 3:30, 4 o'clock. And then, we go live, 2 hours later. So I have to figure out how to rest, say hi to all the dogs, say hi to the queen, and then shift gears once again. And it's always interesting how, when we love, I'm fortunate where I love these sessions. I love the show. I love the impact that we're able to have, and I love the feedback. So thank you everyone for the constant love and support that you guys are giving Karen and I. It's appreciated, and it is heard. So we do appreciate it. Yet it's always interesting when you like what you're doing, how you can always find some energy for it. So, so here we are.
That's true. So I read something once about the fact that, maybe you're not tired, you're just bored or uninspired, right? Because sometimes that's so true. Maybe sometimes you're just tired, but maybe sometimes, it just is that when you love something, you just find that extra bit of energy, right?
Yeah, absolutely. Yeah, so I'm ready. So also that was also me leaning in for some reason my brain's not working good. That was my excuse right there.
Love it. Awesome. All right, cool. Well, let's dive in with our first question, shall we?
Yeah, let's do it. Let's dive.
All right. Number one, thyroid. Dr. Bart, I have thyroid nodules. Is there anything that I can do about them?
Yeah, absolutely. So thyroid nodules, Karen, they typically, what happens if someone finds out they have nodules, that means they went to their doctor and they did usually an ultrasound, and they had an ultrasound of their thyroid for one reason or another. And they found these little nodules on their thyroid. And when that happens, technically, thyroid nodules are like baby soon to be goiters. That's really what we're looking at. So there's a couple ways I really want to answer this. One, we recognize that a thyroid nodule means that there's something about the thyroid that's not functioning good. So we pay attention, and that's first and foremost. If usually by the time someone's getting their thyroid checked out, they already have some lab work done. Unfortunately, most of the time that I see labs for thyroids are getting better out there, but they're not complete enough for us to develop a very definitive, accurate strategy on how to get your thyroid, back on board. Because quite frankly, you want your thyroid on board. It's responsible. It's massively involved in your overall metabolic process. Fat burning, the way how much energy you have, brain fog, all of that. So you want it working good. But if you have a goiter or if you have nodules, inevitably your thyroid has a deficiency in that, and because of the deficiency, you're developing nodules. You're developing a goiter. So it's not the goiter isn't the problem. The nodule isn't the problem. It's what's causing that to happen is really what we want to look at. So in this scenario, the simple answer is this, but I want to answer it in probably more of a clinical way as well. The simple answer is you probably just got to add iodine into your life on a regular basis. Literally, I've gotten rid of thyroids that way. Now, the better clinical answer is say, hey, listen, go get back with that doctor, or with maybe someone that's maybe a little bit more familiar with really looking at the thyroid completely. There's 9 markers bare minimum that we want when it comes to the thyroid, not just TSH, not just T3 and T4. Those are important, but they don't tell the whole story. And that's important to understand. So there are simple things that everyone listening tonight, or if you're listening, it needs some very, very specific. Did you lose me for a second?
Yeah. Okay, you're back.
Okay. When it comes to your thyroid, there's some very specific type of nutrients that we need. One is iodine, and that's probably the most deficient one overall, because it's not in a lot of foods that we eat. And ladies specifically, kind of listen up, because iodine's massively important for your thyroid health, and your thyroid's probably twice the size of a male. So often you need twice as much. And it's also iodine's very important for your breast health as well. So, taking a little bit of a supplement, I typically start very low dosing with iodine. I've started high as well, and it doesn't really do anything, but it's almost better just to get the body used to absorbing the iodine. And there's some other important things for thyroid health, things like selenium. Very, very important, especially when we're trying to convert T4 to T3. That, it's something that the thyroid gland is going to need. So selenium, we can get that from like Brazil nuts, just a couple, like 2-3 a day, or you could be in a supplement as well. Magnesium, very, very important. I think the thyroid is misunderstood a lot. It gets the blame for everything. And one of the reasons it gets blamed so frequently is because it's one of the only things that we, when it comes to an easy test when it comes to your hormones. So it's very common that we'll test something called TSH, which is thyroid stimulating hormone. And so kind of listen close, it sounds odd. When the thyroid stimulating hormone is high, that's considered hypothyroid, low functioning thyroid. Now, all the medications in the world, you may then take a medication, Synthroid, levothyroxine, or something like that. Yeah, it may increase the amount, but we don't know if you're even deficient at that point in the actual thyroid hormone. That just tells you he's getting stimulated a lot, because you could have a downstream issue. You could have something like what we call reverse T3, which is like a mirror image of your T3, hormone. But because of stress, your body's just gobbling it up. So that could be the reason you don't have the hormone. It could be being produced at a perfect rate. So these other markers become real important. So, when it comes to thyroid, and I still think we're going to do an entire show on thyroid, because I think it's a
big one. And lots of people do, as you said, it kind of is something that gets tested more so, not tested properly necessarily, but gets, TSH gets tested. And so people, often get flagged with some sort of thyroid issue without really knowing what their issue is.
Yeah. And, and there's a lot to really go with this. I think from what I saw recently, that thyroid medications here in our country are now in the top 5 medications of all being used right now.
Wow.
I'm
not surprised. Yeah.
But there's so many things that interfere with thyroid function. For example, low selenium or low iodine. There's things like fluoride in our water, chloride in our water. There's all these other halogens that interfere with the way that it's functioning. And unfortunately, sometimes people do need the medications. The challenge, Karen, rarely we even know if that is the actual cause, or like if you're going to need them, but almost always we need to support. And really, this is the part that's so important that we understand. If you have a thyroid issue, if you're listening to this, if you say, well, I'm on, levothyroxine, I'm on, Synthroid, whatever it may be, that was my fix. Probably not, because any thyroid case also has a secondary, if not a primary cause. And it's either going to be, or all of these, it could be one or all, your adrenal glands, your liver, and or your gut. And in my experience, at least 2 of them are involved. The gut's usually always involved, and it's either gut liver or gut adrenal. So, there's so much more to address. Unfortunately, now, more and more people understand this. More and more people understand how to get well from, poor functioning thyroid. without going too deep into this conversation, like I may tend to, even if Hashimoto's, if you've been diagnosed with Hashimoto's, because then I've heard people say, well, I can't use iodine. I have Hashimoto's.
Yeah.
It's not entirely true. We've got to manage the autoimmune condition part of it, and then make sure your body has adequate amounts of iodine. But if you never supply or fix the deficiency, you're always going to have an issue with your thyroid. But really more important to understand about the Hashimoto's, I think we'll leave it on this because I do think this is probably a topic that we should have like an entire show.
Yeah.
If Hashimoto's, because I just spoke of the gut and your thyroid. If you have Hashimoto's, the number one cause of all autoimmune conditions is leaky gut. If you had Hashimoto's, you had some version of leaky gut, it's like a 90%, chance or better. And the primary cause of that is gluten.
Yeah.
And, this is the part I wish was being spoken more of, because I have so many women that come in. Women get Hashimoto's more than men do. Men still get it. I see, so many women, and I said, well, and then I do a diet kind of review with them, and they're still like, well, I don't have celiac. I can eat gluten. No, that is just feeding your autoimmune condition. Never mind all these other toxins and things like glyphosate and stuff like that. So back to the beginning of this question, can you fix nodules? Absolutely. It happens all the time. It is a deficiency, figuring out that deficiency and how to get your body and your liver to function a little bit better. I see a lot of great results with that. Yeah.
Awesome. And really, if somebody wants to, if they get something like that and want to deep dive with you, how do they go about that? They can do it from anywhere in the country.
Yeah, absolutely. The best thing about this, like that thyroid panel I'm talking about, I don't know the exact cost, $150, $200. Like, it's not super expensive, maybe even less than that. It's not as expensive. It is blood, so you go do a blood draw. We can send that requisite to anybody, Karen, and then you go and literally they draw blood, they send us results, and then we can do a review on it. A little side note, and I think one of our shows coming up is going to speak to this. The challenge, and I said sometimes you need the medications, but that does, like, the answer, we can't just end there, because you have to know what the medication is doing, what deficiency is it causing. So just to give an example, this is going to blow people's minds. So listen, if you're on thyroid medication, or someone on thyroid medication, especially females, because this is going to blow your mind, I'm about to tell you. What Synthroid, the number 1 and 2 deficiencies that Synthroid causes, or all thyroid, most levothyroxine, most of the thyroid medications, the 2 top deficiencies they cause, number 1 is iron, and women are already feeling iron deficiency.
All women almost. It's so common.
Karen, and number 2 is calcium.
Yeah, wow, which is another huge thing for women, especially as they get older.
So, and those are important. Like, those are super, super, super important. So, you could be taking a medication for one thing, but it's actually causing. So, and I say the iron first there, because a lot of anemias mimic low thyroid, energy, brain fog. So here you're going on your thyroid medications. You feel great for a while, but then it creates an iron deficiency in the body. Now you have an anemia, and you're just chasing. So that's where, again, we just got to get a little smarter and look at the big picture instead of just that, like, one little test here and there.
Yeah, love it. And look, following on from that, we've got a kind of a follow-up question on thyroid. How do you interpret a normalized thyroid panel, including TPO, in the face of a nodule that is the same size to slightly larger over a period of time?
I'm not sure exactly that.
Yeah. How do you interpret a normalized thyroid panel? So if there's any follow-up, you can type in the chat here. In the face of a nodule, but I guess, I don't know what TPO.
Oh, TPO is it's one of the autoimmune markers.
Oh, okay, all right.
It's peroxidase. So I think if I'm interpreting what that says is what happens when you have a normal thyroid panel, but you still have a nodule growing. That is why we are not just our labs. We are all of it. We are like, so that's, functional medicine is predicated on the fact that we are looking at the function of the human being. It isn't called lab work medicine or, functional labs only. We're looking at the whole, the whole human being, the holistic approach on looking at things. So having, having some history and some understanding of how the body's function is important. So I don't know if that answers that or not, but remember, labs,
maybe even gut tests or things like that you need to look at the whole thing. Yeah, she's just said here, my TPO was previously high, now it's normal. I'm not currently medicated. And I mean, I think what you're saying is there might be some other things then that we need to look at to see, hey, what are some of the what could be some of the things going in your body to cause a nodule?
Yeah. So what I just heard there is that person said that they used to have high TPOs and now they're not medicated. Fantastic. That means they're doing the work. That means downregulate those autoimmune markers, things like gluten. They've helped heal up their gut. So another just random when it comes to the thyroid, and it's so important to understand this. Yeast, which we talked about in the show before, will downregulate thyroid function. Yeah. It'll gobble up it inhibits the absorption of things like selenium and magnesium and calcium and iodine, the things that we need to be able to make those thyroid hormones. So it creates, even yeast will create a hypothyroid function, but there's nothing wrong necessarily with just a thyroid gland. It's being caused by the gut.
Yeah. Okay, cool. Awesome. Yeah, I think we could totally do a whole show on the thyroid for sure. All right, let's move on. Next, yeah.
I was
going to grab your dog?
As I get my dog. Yeah.
All right, you get your dog. I'll ask the next question. What can I do to get off my blood pressure medication?
Okay, love this question because I think this is one of the simpler ones out there. And of course, my little disclaimer here, I'm not acting as your doctor, right? So I'm not telling you, I'm not going to tell you to get off your blood pressure medications, but if you want to create a healthier heart, I have some solutions for you. And of course, always check with your doctor. And there's more that I'd like to know, obviously, if you're a patient and we're talking this, but let's talk about one of the primary reasons that we have high blood pressure is that your body's under duress and it has a deficiency taking place. So your body will increase the amount of blood pressure so it can circulate more nutrients, oxygen, hormones, et cetera, to the body that needs them. So the more stress that we're under, we need more nutrients, not less. The challenge is that when we have diets that are deficient in nutrients and we have high stress, we have a lot of chemicals and sugar, all these things inhibiting nutrient absorption, the heart has to work harder. So what do we really want to do? We want to give our heart a muscle, that's what it is, an opportunity to get relaxed and an opportunity to unwind. So number one, Karen, and this what's cool about this is that they're very, very effective and very inexpensive. Number one, you got to become a better sleeper. Yeah. So it's crystal clear across the board that, for someone like myself, I've been practicing 24 years. We look at all the histories of all the blood pressure cases. There's a pattern. They don't get much sleep. And this is what is so important that we look at, again, from a holistic, perspective, instead of just treating the blood pressure. We got to treat the human who has the high blood pressure. So let's start off with making sure that you're getting plenty of sleep. Number two, the simplest thing out there that I see all the time with blood pressure and other heart conditions, AFib and all those, is an electrolyte imbalance. Yeah. So, and again, these are caused by some of the fundamentals. Like a poor diet will rid you of your electrolytes, sodium, potassium, chloride, those foundational ones, magnesium, all of those are depleted with stress. They're all depleted when we have sugar. They're all depleted with alcohol. Our adrenal gland will burn them up when we're under a lot of stress. So there's a little pattern here. Lifestyle is going to dictate the blood pressure. And I'm gonna offer two supplements too that I, or at least recommend that I use in my cases because they work. They're very, very effective. So those are some of the primary things. Got to get plenty of rest. Got to balance out those electrolytes. I'm going to tell you to reduce the carbohydrates, sugar. Of course, that's obvious. What you're not going to hear me say is, well, the diet is really going to be God's garden. So I don't necessarily say stop eating sodium, because that's not at the root of it. That's not the issue. I'm not going to tell you to stop eating red meat and stuff like that. That's not the issue either. But we do want to get to God's garden. God's garden, I mean, if it comes from a root plant tree, walks in the garden, swims in the sea, then we want to eat it. But listen, blood pressure is one of the things that plagues our country, and because it leads to so many other things. And it seems so innocent to first just go on blood pressure medications and like, oh, no big deal. But that blood pressure medication will lead to the next bad habit, because to fix it, it's all lifestyle. There are 2 supplements that I use, and they're very, very effective. There's many herbs. One of my favorite herbs. So I'm giving you more than 2. So I'm going to throw some out there. And again, these are things you can experiment. Very, very effective. Mother's wort. And I don't talk about that much in here, but mother's wort is phenomenal tonic for the heart itself. But my favorite supplements that I like to use, one is called Cardio Plus. And what makes this so unique, and so this and the other one I'm going to describe, it's got something called vitamin G in it. G as in George, like George over there. Vitamin G is part of the B family, but it's a vasodilator. So instead of being constrictive, that's what causes the high blood pressure, really the muscle cramp, like it's getting tighter. So that's why stress and poor sleep and fatigue and sugar and chemicals in the body create the tightness in the body. The vitamin G is a vasodilator. So it opens up those vessels, and it's not forcing you to do it. It's giving the body the tools that it needs to vasodilate. So helping the body get into more of a parasympathetic state of being, which is awesome. And that's Cardio Plus. The reason we call it Cardio Plus, it is for all the nutrients for the heart. So it supplies all the things that the heart might need in terms of, vitamins and minerals. And then sometimes in some blood pressure cases, especially if they're induced by a fair amount of stress, I'll give them straight up Cataplex G. And with this is what's really fun, I don't know, fun, that's probably not the right word, but the one is we'll utilize this. So remember, all the time when you guys hear me talk about vitamins and herbs and supplements and stuff, the better we get at learning how to use these natural tools, like becoming good at doing that literally can be life-saving down the road. So using Cataplex G when people are having like a moment of high blood pressure, not sure where it happened. They could have been dehydrated. They worked in the yard too long the day before. Maybe 2 days ago, they got dehydrated because they had too much wine, and then they went out in the boat or something, because sometimes it doesn't always add up, the math, and it takes a day or two to like really figure out why it happens. You take the Cataplex G and you chew 4, 5, 6 tablets. Doesn't taste good. Tastes like dirt, because that's part of what it is. It tastes like
okay.
Anyways, and then you swallow it and you have a nice fast reaction. You get vasodilation taking place, and it becomes very calming. So it's very, very significant for people that have a hard time falling asleep because their blood pressure is up. So we talked about sleep, we talked about electrolyte imbalance, and I didn't just say water. I said electrolyte imbalance, because this is important. I've had people that work outside hydrating all day long with water and sweating, and they create an electrolyte imbalance. And then of course we got stress, like stress. So stress is the X factor. We talk about it every single week that we're on here. It's real. We got to stop fighting with that part of reality and recognize that it's not even saying we have to make everything go away. We just got to continue to get stronger. So hopefully that helps. Again, with blood pressure, there's some other things that we do. But mother's wort is fantastic. If you know your stress is inducing it, like your blood pressure goes, and here's how you know, your blood pressure goes up and then it comes back down. It goes up, it comes down. I mean, there's something triggering it. If yours is going up and staying up, we need an overhaul. You got to start sleeping. If you're going up and staying up, you're not rested enough. Period. And now we got to start putting the nutrients back in your body.
Okay, awesome. And I put those supplements in the chat here for those guys who want to jump on for that.
Awesome.
All right. Next question. What exercises can you do on a vibration plate?
Oh, I love it. You can do anything.
Okay.
So a vibration plate, let me explain this. So there's all kinds of like vibra plates out there. I have one myself. I have one here at my house. I have one at my office. I use it frequently. Absolutely love it. There's massive benefits. It's real simple. They don't take up much space, and their benefits are boundless. And this person, whoever's asking, they want to know exercise. That's taken it to a whole nother level. Literally, Karen, you get a stand on this thing, and if your feet are fire, it like goes back and forth, and it gets a really, really high vibration. And because our feet have the second highest amount of nerve input to the brain from any body part, you're literally bombarding your brain with neural input. It's like you're lighting up a Christmas tree. We're turning our brains back on.
Nice.
Way. So just imagine it's like electricity bolts just flowing up your body. And it's lighting everything along the pathway up. So it wakes up your joints. It wakes up what we call proprioceptors. That's just a fancy way of saying these nerve receptors that let you know where you are in space. So they help us move better. They wake up our joints. And it's a very gentle way to do it. So you stand with your feet, about shoulder width, a little bit farther apart, and it starts to shake. We turn it up and it really shakes. So exercising, literally you can go to plank position on it. You can put your arm, like plank with your elbows, plank with your hands, and then flip it over and put your feet. My favorite thing to do though, is then once I've been on it and I don't stay on it long. I stay like 1 to 5 minutes. I know some people like to stay on for 10 minutes. I just get bored. Yeah. I'll stand on the thing and then I'll literally just try to balance on one foot, balance on the other foot. Sometimes if I'm feeling a little bit like, all right, I want to pick it up a little bit. I bring some dumbbells onto the vibra plate and I just go through some shoulder exercises. And it's not about how much weight I'm lifting, but it's compounding the effect of all these different joints moving. And it's significant. Like I do it before yoga because the yoga is so hard for me. So I use this as a way to prepare me to do yoga. So it's, I love it. One of the simplest, if you want to put it in a category of like a biohack, that really, really effective, and anyone of any size and shape can really use it and get benefits from it.
Yeah, love it. Awesome. I'm going to have to give it a go now.
And just real quick note, you don't have to spend a fortune on those things. There's some that'll cost you 10 grand, but you could probably, they're not free, but you could probably spend anywhere from like maybe $700 to $1,000 and still get, you're probably $1,200 but still have a good home unit that you and the family can use. And it becomes part of your, your strategy moving forward.
Yeah, I love it. I think there's studios and there's some gyms that have it as well. Like you can find places to use one, but yeah, I mean, if you can have it at home, that's obviously ideal. Okay. We've got a question that was emailed in. So we've got a couple of parts to this. The first part is, I have started taking some antioxidant supplements and want to know, can one take too many? Is there any danger of taking supplements listed as antioxidants with the recommended dose? So if I take them at the recommended dose.
Okay, great question. So could you take too much of things? The answer is yes. We can take too much, but here's probably the most important part of this answer I want to give you. So if you're using whole food supplements, very, very difficult to do anything wrong.
Yeah.
Even when it comes to antioxidants, because meaning you're using whole food sources. So it'd be the equivalent of me saying, hey, listen, I'm gonna have you eat a massive ton of broccoli and cauliflower. And what's like the worst thing that can happen? You get really full, get a little uncomfortable, but when the food digests, it's gone. And hopefully you're going to, upload your vitamins and stuff like that. So the primary antioxidants, Karen, in the body, I'm testing myself now. So it's vitamin A, C, E. Those are all probably the primary antioxidants of that group. A and E, we have to be very careful how we get these types of antioxidants. We absolutely do not want synthetic sources. So what I'll see people write papers on them and stuff like that, like the dangers of too many antioxidants. And it's always because there's synthetics involved. You've heard me say on this show before, I'm not a fan of synthetic vitamin A and I'm not a fan of synthetic vitamin E because the body still doesn't know how to process those. And what does that mean? They don't come from whole food sources. So like I'll use a vitamin E. My favorite is wheat germ oil. And then I love vitamin A for what it does in the human body. It does so many incredibly important things, but almost always it's supposed to have this very synergistic relationship with vitamin D. And that's why I love old school cod liver oil, because vitamin A and D come together. CoQ10 is another great antioxidant. So can you overdo anything? You can. If you take what's on the prescript, usually on the, the dosing on the bottles, typically that is super, super safe and super conservative. So you're usually fine there. Most importantly, though, when it comes to any of your supplementation, do your absolute best to make sure they're coming from a whole food source. And that means when you look on the back, it says in the ingredient part, not necessarily where they break down vitamin A and C and D and all those guys. That's called an assay. That's going to tell you how many, micrograms or grams. You're not looking at that. You're looking underneath that where the ingredients are. And it should say things like bovine beef, liver, cauliflower, Brussels sprouts, carrots, beetroot. That's the ingredients. That's what I mean by whole food.
Yeah, love it. And then the second part of that is, can you take too much collagen? I take 1 scoop in the morning and 1 at night, but I want to add in my lunch drink as well, as I think it's helping my arthritis.
So this person's making me think of myself at this point, because often I'll be like, man, this is good. Why don't I just keep taking more and more? So again, with collagen, safe, there's not there again, it's very, very safe. It'd be very difficult to do too much. When you're talking about doing a couple scoops a day, no big deal. I put a scoop and a half to 2 scoops every morning in my coffee. And if I happen to have 2 cups of coffee, that means I'm going 3 or 4 scoops every morning. So, and I'm doing all right. And I've said it here on the show before, I think collagen has been a big player in me healing up my leaky gut and me taking care of things like Crohn's. So I'm a huge fan of us using it. So it's easy to digest and it fits perfect with any smoothie and any coffee. So unless you're really being ridiculous about it, I do not think you can overdo it.
I did have someone I was talking to in a health food store actually, who had taken too much collagen and had found that she was getting a lot of skin tags from the collagen. That was her only. Have you heard of that before? She said by taking too much collagen, she was starting to get those little skin tags. It could have also been something else she was taking, but I was curious.
Nope, never heard that. It doesn't mean it doesn't exist, but I've never heard it. And in this last 5 or 6 years, these have been the last half decade of collagen, and I've yet to.
Yeah. What collagen do you recommend?
My good friend Josh Axe has one called Ancient Nutrition. I use this product every day. There's a lot of good ones out there. I just happen to use that one.
Yeah. Awesome. Love it.
And I use the multi-collagen one. There's all different kinds. So I use the one that has the multi-collagen.
Okay. Cool. All right. Next question that we've just got on Facebook here. I'm just getting over a horrible case of COVID. Developed pneumonia and had nearly every symptom, but the worst is I'm having migraines, headaches that I've never experienced before. It's been a few weeks now and I'm still getting migraines after about 1 or 2 a.m. I'm extremely healthy and eat mostly fruits and vegetables, lentils and nuts, nearly no sugar, maybe once a week. Can't understand how this is so bad. Have you heard of these headaches with COVID and what can I do to help?
Okay. Well, I'm sorry that you're not feeling good. And yeah, I have heard of this. These symptoms afterwards have often been much worse than the actual virus. And this is a clearing issue. So I would say a couple of things. One, first step right away, make sure that you're taking copious amounts of magnesium. In this scenario, I would recommend magnesium lactate because it does cross the blood-brain barrier pretty gently. When I say copious amounts, if you're not taking any already, and if you're going to use magnesium lactate, I'll start at 3 at night, 1 in the morning, but you're going to titrate up, and you're probably going to get to 5 or 6 at night. And I do know that that's going to create a fair amount of loose stool, but I'd be okay with that because we've got to get that back, and make sure we get some magnesium where it needs to be. The second part of that is I would make sure that you're taking plenty of DHA, which is, that's your fish oils. So what happens in the brain get a beating too, and you get inflammation in the brain. So we want to, is everything we can to flush the system out. The challenge here, Karen, and for that person's experiences, the brain filters last. The body has to be completely cleaned out. It's almost like it drains from the bottom down. So it's the last thing to clear out toxins, the last thing to clear out heavy metals, the last thing to clear out parasites and funguses and stuff. So you really got to do your work. And what I mean by that is I would probably get with somebody that's familiar, like understands we definitely got to clear out the liver, use some milk thistle there. Intermittent fasting right now is going to be important so we can downregulate the inflammation in the body. Super strong doses of turmeric. I like the turmeric forte. Again, especially in this one, even if you're taking another turmeric, I wouldn't play around with it. Not play around like it's bad, but you want something to cross that blood-brain barrier, and it's bound to fenugreek. So I would probably take 6 a day of those right now. Make sure you're getting plenty of rest, and make sure let's make sure all your electrolytes are balanced. Your body was the battlefield. And if you picture 2 armies came together and now it's a mess, you got to clean the entire thing up, and you're going to lose massive amount of resources, massive. So whatever you're doing for supplementation and eating before, you've got to catch up now. So that's really my best input there. Magnesium, the fish oils, clean the body out. I would be on an intermittent fasting schedule. Not always fun with migraine headaches, so you'll have to really dance with that one, and know that this too will pass. It will. I promise. So far, I haven't seen anything linger where people haven't overcome stuff. So as gnarly as it feels, this too will pass. Stick forward. If there's a way I can help, I'd be happy to.
Yeah, awesome. And I put all those supplements in the chat in Facebook for you, so you guys can get those. Okay, next question. Dr. Bart, what are your top fat burning tips?
Top fat burning tips. These are always fun. These are always fun. So I'll give you 5. And we were joking earlier. So I'm going to give you 5. I get these questions all the time. People don't always ask me exactly Doc, what's the best fat burning? They try to navigate the question because they don't want to ask that question.
Yeah.
Good for I'm just trying to drop 1 or 2, whatever. So I'll go through my top 5. And when you look at these, oftentimes people will be like, yeah, I kind of do that. But there'll be 1 or 2 that you're not doing. And that might be the secret for you to get, to break through that next level if you want to, lean up a little bit. And there's nothing wrong with that if that's what you want. So number 1 is this. We got to get the carbohydrates down. So number 1 is this. You have to become fat adaptive. So you got to use fat for fuel. But if you have carbohydrates and sugar, you're burning those first. So you really never get to fat. So that would be number 1 for me. Number 2, no gluten. Absolutely, positively no gluten. It's pro-inflammatory. I pretty much should start every show and just say, if you haven't heard, Dr. Bart says, don't eat gluten because there's really no value in your life for it. So I was having a conversation with a gentleman today, and we were talking about gluten. He's like, but I don't eat sugar. That's my only vice is gluten. I said, well, really? I said, do you know that here's interesting, that bread burns faster than
Pretty
sugar.
much sugar. Yeah.
So anyways, so number 1, lowering the carbohydrates. That means everything. That means your bananas, everything. Because your body, if it's converting food real quickly into carbohydrates, then you just use it as a sugar source. We got to become fat adaptive. Number 2, we're going to get rid of gluten. Number 3, intermittent fasting. Intermittent fasting should be number 1, but I'll just put it at number 3 because that's what I'm thinking about right now. And we titrate up, start at 12 hours, 2 weeks, 14 hours, 2 weeks. Women hang out between 14 and 16 hours. Men stretch a little bit, 16, 18 hours. Do not make the mistake and try to use intermittent fasting as a starvation diet. It will backfire on you. If you just say, well, I'm going to see how long I can hold out today. That's not what we're talking about. We're talking helping your body become fat adaptive. So that's number 3. Number 4, move your body, exercise on an empty stomach.
Okay.
Yeah. So force your body into a state of going, I don't have what it takes right here, right now to keep up with this demand. So the law of supply and demand wakes up your hormone system and says, let's produce more growth hormone. let's produce more testosterone. And growth hormone for both men and women is the number one fat burning hormone in the human body. And growth hormone, Karen, does not exist simultaneously as insulin does. So you can have one or the other. So if you are eating, you're carbing up for your workout, you will not produce any growth hormone during your workout. And then if you have, your post meal and your pre-meal and your during meal and all those different things, then you're selling yourself short. You're hurting, you're harming yourself, and you won't even produce the number one fat burning hormone, which is growth hormone. And then here we go, big one, sleep, baby, sleep.
Yeah.
Probably the most overlooked. You notice I didn't say anything about HIIT exercises. I didn't say anything about 2-hour cardio sessions, none of that stuff. Yeah. This, for the most part, burning fat is going to happen in the kitchen and when you're sleeping. As crazy as it sounds. So see where you can improve on those. For me, it's a pattern in my life. If I get off on sleep, that's when I'll start to gain weight. I got my diet dialed most of the time, but if I get off on sleep, and I find most people that, again, sleep in this country is a big issue. Sleep in this world is a big issue. We think we get enough, but it's not always adequate enough. And your metabolic system is most active at night. And so if it only is active for a couple hours, you just don't get the best bang for your buck. So let's get really good at becoming really good sleepers.
Yeah, awesome. I don't think we can say that too many times, right? Because as you said, we have there's just, sleep is a huge problem for so many of us. So yeah. Okay. Next question. I have a nephew who is 17, began having seizures at 12. Any diet or supplements that might be beneficial? He is currently on medication, but about every 5 to 6 months will still have a seizure.
Yeah. Okay. There's a lot there. So the answer is yeah. A protocol here. Can you hear me, Karen?
Yeah, it's back. Yeah.
Absolutely, positively. There's a protocol here. In fact, and I think I've shared this story here on the show before, where my first keto case I ever did was like an 18-month-old little baby when the mom called and said, "Hey, I hear that chiropractors know how to shift someone into a ketogenic diet." And I said, "Sure, come on in." And then I did my research and helped this little baby essentially. This was back in the day, no Google, we literally had to read old school books on how to do this. And they didn't hear anything about keto for 18 years, literally. Here's the answer to this. So if these seizures, I'm making some assumption here that there wasn't a trauma at 12 years old. If there was a trauma, there just needs to be a couple additions here, but absolutely positively, intermittent fasting and a ketogenic diet. Full blown, not dirty keto, not kind of keto, whatever. The brain is made of fat. You got to become a fat burning machine. And there's so much evidence. There's so much good research out there on reducing seizures with a ketogenic diet. So I would do it guided. I would get together with, a practitioner or someone that's familiar with it and understands the journey. And I would have that. I would encourage that is not just like a one and done, but they work with that person over several months so they get the swing of it and understand the highs and lows. If I heard you correct, they're on medications and still get a seizure because the medications down-regulate but do not fix. And I'm not, listen, it's not safe to have someone going into seizures. So you gotta down-regulate that seizure episode. You can't just let it happen. So I understand why people go on medications, but there are alternatives. And most likely they can be an and world in the situation, Karen, where they can be working on fixing things up and healing up the brain. There's a deficiency. There's something taking place in the brain and it's not firing right, and it misfires, and usually a deficiency. And then it can be also on the medications in most cases that I've seen, and be working on that simultaneously. And here's how simple it is. If they're 12, and I think they said they're 17 now.
17 now, yeah.
They're a teenager. The likelihood that they have probably an 85% carbohydrate-based diet right now is real.
Yeah, totally.
So so that's a great place to start right there. Now, I think you said nephew. right?
Yeah, correct.
So the conversation is going to have to be had with parents because, and I say that because this is the reality of in practice. So the one person says what's really good, and they go back and they're like, well, what does that mean? He's got to eat some good proteins and higher fats. And it'd be easier if I give him pizza tonight. So that's a family conversation, but yeah, absolutely, positively. There's definitely a protocol for this, and there's definitely a lot of success out there with this.
Yeah, awesome. What is a good supplement for helping memory?
Memory. I have a couple favorites here.
Okay.
So before I give you supplements, you got to hear the rest of this, right?
Yeah, give it to us.
What takes away from memory? So remember, human beings are awesome. We have incredible memories. Like we do. We have we're maybe not quite like an elephant, but we're damn close. Like a lot of remember what happened 50 years ago. So we have awesome memories. What we forget about memories, which is ironic, is that we are interfering with the way our brain is functioning. So let's go. God's garden. So if it comes from a root plant tree, walks in the garden, swims in the sea, that should be our nutrition. We absolutely positively got to get the sugar and carbs gone. Sugar creates so much inflammation in the brain. Karen, sugar shrinks the brain. Shrinks it. Shrinks it. That's an issue. That's definitely
we eat copious amounts of it every day. Like probably not the people on this call today, but as a culture, copious amounts every day.
So if you don't sleep, so here we go again with sleep. If we're not sleeping, our body shifts more into this fight or flight survival mode, and short-term stuff, memory, names, and the words, those kind of stuff are not paramount to us. They're not survival type things. So we start to forget this. And I'm going to get to supplements in just a moment. So, but I don't want to discount these because when we get these things dialed in, we recognize that we can really improve them on our own. And then also intermittent fasting, becoming better. And again, using that scale, 12 hours for 2 weeks, 14 hours for 2 weeks, 16 hours for 2 weeks, becoming good, practiced at intermittent fasting. As you become fat adaptive and burn ketones for a fuel source, your brain lights up. All right. With all that being said, so now there's a couple things. One, Bacopa and Ginkgo, phenomenal, absolutely phenomenal. We have a brain tonic in our office. If someone wants, they can call it liquid. It's awesome. Literally, I did that's part of my strategy every night, every Tuesday night. I do copious shot, like a big shot of both Bacopa. It's a blend, but it's a ridiculous big shot. It's probably 2.5 times what I usually recommend.
Is it a standard process product called? Is it called something?
So they standard process in MediHerb, that company that I use mostly. They do have Bacopa. They do have Ginkgo. But I created a brain tonic. One's great for short-term memory. One's great for long-term memory. I blend those together and use something else called Eleuthero, which is phenomenal for the brain as well. So literally, it's a brain tonic. It's just awesome. Wow. So that is my number one. If in the event, and I think we discussed this last week or the week before, if it is just words and names that you're forgetting, you want to bump up, go heavy for a couple of weeks on something called RNA, ribonucleic acid. You can eat a can of sardines per day if you want. That gives a good amount of RNA. So you laugh, but like I got peeps eating sardines nonstop. Like it's awesome.
I just really struggle with sardines. I wish I got but cool.
And sardines, that fat and that protein, so satiating. Like it's such, man, like if you can get over it, like it's such one of those easy tricks to just like balance you out. So if in the event, whoever's asking if, in general, it's just like those names and those words aren't coming, they're on the tip of your tongue, you can't get out. Ribonucleic acid, awesome. The herbs, and that's more of a vitamin supplement. But when it comes to the herbs, Ginkgo and Bacopa, the absolute best. And if you want, we literally have a liquid tonic called Brain Tonic. Yeah.
Okay. Love that. Yeah. Okay, next question. From Bobby in Texas, he writes, I just started CPAP therapy. What is the best supplement to help me sleep?
All right, Bobby from Texas. Good to see you, brother. So again, everything we've talked about, sleep. We got to get the gluten, the carbs, the sugar's got to go. CPAP is, we go on CPAP machines because we have an inflammatory condition going on. That is the issue with breathing. So for sleep, we got to set the stage so we can sleep properly. So we want to do anything and everything we can to reduce the phone usage, reduce the computer usage before we go to bed. We got to set the stage. Some of my favorites for calming the body down: magnesium, absolutely phenomenal. In this scenario, if you're on a CPAP, we know there's an inflammatory process there. So things like your fish oils, the cod liver oil, and the turmeric, perfect, through the course of the day. Obviously, getting rid of the sugar and the gluten. We got to reduce the amount of alcohol that one's having, if there's any of that there, taking place there. If the event you're having a hard time falling asleep, you can use an herb that I love. It's called ashwagandha. It often will help, pull you out of that sympathetic dominant state. If you're having a falling asleep issue, you can also use something called kava, another herb. It's a great medicinal effect of just really calming the body back down. If you're staying asleep is the issue, usually that's a magnesium issue as well. But ultimately, think, Bobby, that if you're on a CPAP machine, you have an inflammation on every angle that we've been talking about tonight.
Yeah, awesome. Okay, cool. Next question. I've had increased arthritis in my right hip over the last year, and I'm looking into stem cell injections instead of a hip replacement. Do you have any opinions on stem cells?
Yeah, I love the science that's coming out about them. I think that there's a lot to be said for stem cells. I think that it's becoming more and more popular. Here's I'm going to cut right to the chase here. I think that one of the reasons that the stem cells isn't going through the roof and everyone's not doing it in every doctor's office is because the results are still, let's just say they're 50-50. I think that's about accurate. And I'm going to tell you, I think the results are 50-50 because we're not tying in the nutrition component here.
Yeah.
Those stem cells develop new cells in the body for new tissue growth. So we literally, it's like the anti-aging process. But if we feed those stem cells with inflammation in a bad diet, you're back in the same spot and you're just literally going to waste away thousands of dollars. So I love stem cells, but if my patients come and say, "Doc, I'm going to get stem cells, what should I do?" I say, "All right, give me at least 6 weeks. Let's get you clean as can be. Let's prepare your body. Let's reduce all the inflammation." And the beauty is a lot of things like the arthritis and stuff like that start to get better right away. Let's go all in here. And remember, the stem cells can cost thousands of dollars at times.
Yeah.
And when people have those magical stories, me just clinically, Karen, I'm observing this. I think it is because the ones with the cleaner diets and lifestyles get very effective results. But if someone comes in and they literally eating at McDonald's every day and sucking back, half a case of beer every night, so I'm probably gonna tell you not to waste your money.
Yeah, no, for sure. I mean, anytime you're not addressing kind of what's been happening in the body, it's just going to keep happening, right?
Yeah. So it's really, again, that real holistic approach. But I think the science in the future, I think so much of it, the more we understand about like intermittent fasting, like one of the things that it does, it helps the promotion of stem cells within our gut. Like this is real science popping out and how we can do this naturally. And also technology to say, man, like maybe you beat up that hip, and maybe this is a fantastic opportunity not to have a hip replacement surgery.
Yeah, or for injuries, I think they're using it as well. Like if so it's not kind of like a chronic issue like arthritis where it's like an injury where that can help with healing. That's something they're using it for as well, right?
Absolutely, especially in areas body's natural inflammatory responses there. Sometimes it's just as good, almost even better because the body's looking for that tissue growth.
Yeah, awesome. Okay, running out of time. We're going to have a couple more questions quickly. Question here: why do I crave tomatoes?
That's a good question. But there's almost always something about cravings. So I don't have a solid answer. Maybe your body's craving a little bit of vitamin A in there. Lycopectin, I think it's called. Super, super good for everything from your immune system to your eyes. So often I'll say when it comes to a whole food source like that, trust it, but don't overdo it, because on the same part of that craving could be an inflammatory response. So waking up some things. So make sure if you're eating those tomatoes that you're not getting watery eyes and runny nose, and making sure that, your body still feels pretty good afterwards. But most likely a little bit of a nutrient deficiency. Sometimes tomatoes, oranges, things that have a lot of water in these fruits and vegetables. And they have again, we talk about electrolytes, like it could just be an electrolyte imbalance.
Yeah. Yeah. But I think great to listen to that, or to think about that. Often we, we're craving this or that, but your body's smart. It's usually craving it for a reason, right? Or craving it, there's something that it wants.
Yeah, our bodies are absolutely brilliant. If we take the time to listen, there's a lot to be said, no doubt.
Yeah, for sure. Moving on from the kind of following on from the arthritis, do you ever have pain, Dr. Bart? There's a question here.
Yeah, it's funny you say that. I got that question twice today, Karen, in clinic. And I think it's a great question. And the answer is yes. I have pain. Yes, the answer is I have a fair amount of pain. And this came up today because there was a patient that was real frustrated, and they're doing all the things right, but she still has a fair amount of pain. And then they said, well, you don't ever have pain. I said, no, we're talking about so maybe why I have pain. Maybe this will just help people understand. If you're out there doing literally 1,000 different things properly and you still have some discomforts in your life, let's kind of roll through how part of this is. So is my diet on point? Yeah, I've never had my diet so dialed in my life, especially consecutively. I don't go off the railings. Worst thing that I do is eat too many peanut butter balls. That's it. That's my vice. Yeah. Do I move my body good? Yeah, I move my body good. And so I get my yoga and my ritual and everything. Yet every Wednesday night, I go to Fight Club and I get a beat down. So I also beat my body up. So, and then I've got 50 years of a beat down in my body too. So I'm working with deficiencies and injuries of old. And most people that are listening to this, same thing. And I hope that I never put out the message, Karen, that, I do all these things right and all of a sudden it's all perfect, because it's far from it. It's far from it. It's the journey of knowing that every effort does matter. I know for me with my diet, Karen, we talked about this briefly. If I go gluten and sugar and ice cream again, man, my 4s and 5s of pain feel like 9s and 10s.
Yeah.
No doubt. Brain fog, headaches, all of that stuff. And I don't wish to go there. Everything is having a little bit of a compound in this. My biggest vice, and here I'm talking about it all night long, sleep.
Yeah.
And because I use my body so much, I'm a knucklehead. So I'm going to use my body. I love it. I love moving. I love yard work. And I love, but the challenge with my sleep is I'm a good sleeper. I can fall asleep.
Yeah. Tell us your challenge with your sleep.
Right here, these little critters right here that bank up against me for some damn reason, I don't kick them out of my bed. It's ridiculous. Yes, this little girl and that little boy over there. So my vice is my own issues, my sleeping patterns. Not that I'm not a good sleeper, but when I have the bulldogs in the bed, I don't sleep good because I wake up in pain. So I have to into yoga just so I can stand up tall. So the reality is, and so I never come across as if, all this is working out perfect all the time. It's a journey. It's but if I tell you what, if I put 2-3 nights of good sleep in a row, beast mode. And why does it motivate me to get these little critters out of the bed? My dog owners understand 100%. They understand. Maybe my moms, they let their children crawl in bed with them, and heaven forbid they disrupt their children. So they, you sleep in a funky pattern and you wake up in pain. The challenge is, here's the difference. There might have been a time in my life, then I would go and be like, oh my God, my back's killing me. There's something wrong. What's going on? Now I'm like, I'm not arguing this. This is my fault. I I let the dogs into bed again last night, and now I'm paying for it. So not fighting with reality, and letting yourself just kind of go for more. I think that's really important. The dialogue I was having today with someone that it was like, we're saying, I was like, well, do you sit much and blah, blah, blah. And there was two things it came down to. For this individual that we were talking to, one, they're like, I don't sit at all. And all they did was drive all day.
It's a lot of sitting. Driving is sitting.
And so sometimes we got to step back. And even though it's what we have to do, it's still part of, is it adding to or taking away from our health. The other part is this: upstairs. So much of discomfort and pain. Like if you're angry, if you're frustrated in life, you're going to have a lot of pain, and how do you know if it just stays with you day in and day out, and you're looking at everything, or if you just know you're frustrated or angry. I know for the days that I'm frustrated, man, like it just feels different in my body. And every one of us has that vulnerability. So if we think of it that way, and we did that whole episode on pain and how important the role of our brain is in that, in that whole process. But the answer to the question is, do I have pain in my life? Yes, I do. I definitely do not walk around in like some pillow fluff life that doesn't have any discomfort. Like I am no doubt working and managing it regularly. And the good news is, Karen, is that when I add up all these things, my body feels better than it ever has before. But do I always add up all the things? No.
Yeah, no, I love it. And I think it's a good real talk question, right? And also people, if they do have to drive, then try to make sure you're dialing in the other things. Or if you do have to have dogs in your bed, then try to dial in the other things, right? So we can dial in the pieces that we can to also do the things that might not serve our body 100%, but they serve something else, right? Like you love having the dogs or going to Fight Club or those kind of things. It serves a different part of your health, right?
Yeah, 100%.
Yeah, awesome. All right, well, we are out of time. Thank you so much, everybody, for all your questions. Let's do our last one. I mean, we always go through so many different things with these Q&As, but what's going to be the one action our listeners can take to move them towards their goal of becoming superhuman?
Real simple, and especially after, I practiced today, just a common theme was just continue to go for more. For more, have fun with the journey, have fun with the process. Just let yourself go for more, whatever that more is for you. Like, just go for it. You rarely ever hear me, here on our show, or even when I'm in clinic, I rarely tell people not to do things. I'll tell garden other than gluten, right? But I'm always encouraging. And if you love Fight Club, if you love riding your bike, if you love being a cyclist, you love running, go for more. Go for more. Yet do what it takes so you can do it in a healthy fashion.
Yeah, love that. Awesome. Well, we will be back again, same time, same place, for another episode of the Health Made Simple show. So we'll see you guys next week.
Awesome. And once again, thank you all for being here. Appreciate you guys. Keep doing your thing, keep sharing out, keep spreading love, and of course, take deliberate action for your mind, your body, overall wellness. Go awesome.